Good morning, guys. Breathe the MP here, also known as Brianna. I am so excited to be taking over the Instagram story today. We're going to be chatting about a lot of things, so let me just, before I get ahead of myself, just introduce myself again. I'm Brianna. I'm currently a pediatric nurse. I work in the pre-op and PACU areas, so preoperative and post-anesthesia areas. I've been doing that for the last 3 years. I've been a nurse for 6 years, and my experiences ranges from a whole bunch of different realms. So I started out actually at an LTAC on the ICU floor, and then after I figured out that wasn't the place for me to be, I did a nurse internship on the cardiac med surg floor, where I stayed there for almost 2 years, and then I transitioned my specialty into emergency care because I love the ED, and that's actually where I started at. I started my healthcare career as an ED tech. Yeah, so I started as an ED tech and then got into nursing afterwards. So that was the great transition. So if you guys are starting and you guys are nursing assistants or medication techs or whatever the case may be, I really think that that's a great first start, and then to transition over into nursing, that's great. So I went from the ED, and then now I'm working in peds, and it's so crazy because I always told myself, like, I'll never work in peds, I'll never work with children. And it wasn't even because I didn't like the pediatric specialty. When I was a little girl, I was growing up, I always used to have my doll, and I used to tell people I'm going to be a pediatrician all the time. And I kind of wavered a little bit with my nursing journey, and we're going to get into that, but I ended up in pediatrics, so I guess it was God's plan, and I love it. And so, that is kind of my nursing journey in short, but we're definitely going to get into the details and everything. So before I start to get into the nursing journey and the things that I'm really passionate about, like helping nursing students and nurse practitioner students, I want to drop the question box here just so that we can start getting you guys' questions answered, so I can figure out what things that you guys want to know about little old me and my nursing journey and all that stuff. So I'm going to drop the question box, and you guys feel free to just post any questions nursing related, and I will get to them as the day goes on, because we have to make a Starbucks run, because nothing starts the day but Starbucks. Are probably like, wow, she's doing a takeover, but she's not even at work. She doesn't have any scrubs on. Listen, it is my day off, and if you see the post that Nurse.org just posted, which was me saying it's okay to say no to extra shifts and all of that other stuff, that was me today. They asked me all week, can I work on Friday? I'm absolutely not working on Friday. It is my day off, and it is my day for self-care. So you guys are going to be with me all day while I am letting my brain reset and doing some self-care. I'm on my way to Starbucks, about to get my favorite coffee, and that's what we're going to be doing today. Told you guys, my journey to wanting to be in healthcare started really early. I used to carry around my doll and everything like that and tell people I wanted to be a pediatrician. But as I got older, I used to say, I want to be a doctor. I want to be a doctor. And it wasn't until I lost my father to gun violence that, I had an encounter with a nurse. Before that, I never even knew what a nurse was. But the nurse that was caring for my dad and just, caring for the family, because, the patient is not just a patient, the family is too. And she did a really, really good job just explaining things and making me feel comfortable. And from that point on, I just felt like, I want to be like her. I want to be the person who, is calm in a crazy situation, can comfort the family and still make sure that the patient, is getting the care that they need, whether it's end of life or not. So that was my introduction to nursing. And it's so funny because even though I already knew exactly what I wanted to do, I knew I wanted to be a nurse, I still went to college because I was already accepted. I went to Hampton University, and I started as a biology major because I was like, maybe let's try the whole pre-med situation and then see if I like it. I did not like it. I did not like it at all. So I changed my major to nursing, and it was kind of hard to maneuver at first because people who were already there already had their study groups and stuff. So I had to meet people and start doing study groups and everything like that. And nursing was really difficult. I didn't know how difficult it was. And also ending. And I don't think people talk about, like, how hard it is to get back up on the horse after you feel like you failed something. And so that's really important for me and, to express to my followers on my page. I am back in my office, y'all. So after failing the nursing program, which was super devastating, I had a really big decision to make, and I don't even know that I was ready to make that decision. But after failing, I had to make a decision like, am I going to go home and just quit, or do you want to transfer your credits to a degree that may be helpful, and then, try again with nursing school? I ultimately ended up transferring my credits and transfer my major to psychology, because that was the only major that would really kind of mirror my credits and take them, so I wouldn't graduate super late. I ended up graduating a year late, and after I graduated, before I even graduated, actually, I started to search out nursing programs, but it was really hard for me to get into big nursing school programs. So I tried my hand at So I decided to try my hand at applying for associate degree nursing programs, and I got accepted to Bryant and Stratton College, which is in Richmond, and I was so excited. I actually started the nursing program before I walked across the stage to get my psychology degree, and I was excited that I had a second chance at my dream, but I was also nervous because I was like, man, you failed before, you know what I mean? Like, this time it has to be different. And so it was different. I definitely had some challenges. Math is not my strong suit, so I really had to figure out how I best learned, how I best studied, and how to conquer math. And I was able to do all of that, and I graduated with my associate's degree in April of 2015. I think now is a good time and a good pin in the story to start answering some questions that we have. So I'm going to answer some questions for you guys, and then I will continue on with my nursing journey. If you guys want full breakdown details of my nursing journey and everything like that, I'm going to pin my YouTube page, because that is how I really connect with my audience. It's something that I've always been passionate about doing, because nobody talks about their failure stories, and I think that that's a detriment to our healthcare community, because we want to be able to build each other up, not suffer in silence, right? So I'm going to link my YouTube page. You guys can go and like and subscribe, but I talk about my nursing journey. I talk about, me working through nursing school and working through my master's program and how that was, and just giving little tips and tricks and stuff like that. So I'm going to answer some questions, but I'm going to link my YouTube below as well. I think an internship or residency is good no matter where you go. I did an RN internship at my cardiac med surg job, and it was great. Slow paced orientation, lots of education. We also got to float, so we know what that feels like. So I think this is a good way to The reason why I asked about location is because if you live in a small city that has 5 schools and they are producing nurse practitioners, of course the market would be oversaturated. But if you live in a hub like me, I work in DC, but I live right in DC, Maryland, Virginia, there are more opportunities here. I think it also depends on how you look at the market. It took me 4 months to get my first NP job. Some people get NP jobs right out of school because of their preceptorship or something, and they offer them a job. Some people, it takes them over a year. I think it just depends on where you are. It also speaks to what part of the journey you are in as well, because what are you doing to make sure you're prepared for these jobs? Do you have a crafted resume? Have you been networking? Have you been doing whatever you needed to do in your clinicals to maybe they could offer you a job once you're done? Some some people, are still on their job search journey and maybe haven't gotten lucky yet, but I'm telling you that it's coming. Please stay the course. Don't get discouraged. I know it's hard, but whatever God has for you is for you, and you're going to get your dream job. I promise. Believe that Peach chose me, and it was God's way of connecting, like something I said I wanted to do early on in my life, which was be a pediatrician, and now working in pediatrics as a nurse. It just chose me. Sounds cliche, but I really think their pros and cons list is the best way to go about this. But you need to include things like, are they accredited? How long is the program? What are they offering to their students as far as support, as far as scholarships and grants? All of those things are important. I think this all depends on what you want to do with the PEDS experience once you get it. If it's going to help you get to a goal, I would suggest doing an RN internship, because you can do that as an established nurse. But I think it's up to you to determine if it's worth going back to the bedside to get the experience. Y'all are probably going to get tired of me in this office, but this is my happy place. This is where I go when I'm off of work. So anyways, after I graduated in 2015 with my associate's degree, I moved to Dallas because I wanted to change. So I picked up all my stuff and moved to Dallas and started my nursing career there. So my first job was at an LTAC, so a long-term care facility on the ICU floor. And I really appreciate that because, I got to learn a lot about trachs, vents, different kind of drips and stuff, but it wasn't the best place for me to start. So I started my nurse internship program at another hospital in Dallas on the med-surg cardiology floor, and I loved it. I mean, the extra education, the slow down orientation, we got to float and do different things like that, so that was great. It was just a great introduction. I quickly decided it was time for me to go back to school to get my bachelor's in nursing, my BSN, and I really wish, for people who start with their associate's degree and decide to get their bachelor's online or whatever, for me, I really wish that I did more research on different schools. I think I researched only 2 schools. I ended up going to Western Governors University, which was great. I mean, I love the program. They had a lot of support, and I did everything online, and my job actually paid for my BSN in nursing because I got tuition reimbursement, which is also a great thing. So if your job is giving you tuition reimbursement, obviously, read the fine print about, what kind of commitment you would have to give back to them. But at that time, it wasn't a whole bunch of commitment I had to give back. So they paid for my BSN, and I got my BSN from Western Governors. I actually graduated in 2017 with my BSN. And during that time, like around 2016, I started to really network with other nurses, and I started to learn about what nurses actually, do outside of their job, and just started learning that, nurses aren't just nurses. They are authors, they are entrepreneurs, they are public speakers, and own radio shows and work in real estate. And I thought that was so cool. So I started like a community called Not Just Nurses, and my website was called Not Just Nurses back then. Actually thinking about reviving the community because I think it's needed, especially because throughout the pandemic, nurses need support and somewhere to come to be able to vent to each other and really just lean on each other. So I'm really thinking about reviving that community. But for right now, you guys will get Breathe the NP in all her glory. So I finished my BSN in 2017, and at that point I had already, or like a couple months before, I had already transitioned into becoming an ED trauma nurse. It's something I've always wanted to do, and it was an easier transition thing, so it wasn't hard to sell myself for that job. And they actually certified me in trauma like 3 months after I started that job, which I thought was really great, and it's a great resume builder for other places that may require critical care or emergency care to get to different specialties. So I think it's really important for you guys to really hone in on your skills. If you can get certified in other places, definitely do that. It works wonders. After doing like a year of trauma nursing in Dallas, I actually moved back here to the DC area, I think at the end of 2017, and decided that I wanted to go back to school to get my master's degree. So I've been in school for the last like 13 years concurrently with like 6 months breaks and stuff like that. But I just wanted to get it done. I actually started my MSN program at Chamberlain, but I got all the way to like where I was going to start my clinical, and then my GPA had dropped below that threshold, and I actually got dismissed from the program because life was happening at that time. We all know life just starts to elevate and happen a whole lot more when you're in nursing programs. I know y'all feel me. So I was kind of devastated about that, but I was just like, maybe it wasn't my time, maybe this is not where God wanted me to be. And then I applied to Walden's Nurse Practitioner program, and I graduated this past May. Graduated with my MSN from Walden University this past May. I took my boards in July. I did have to take my boards twice. I'm not ashamed to say that. The first time, I think I was just like in my head, you know, really nervous and second guessing myself. And I know people have dealt with that, even taking the NCLEX. I didn't. I actually obviously was nervous, but I passed my NCLEX on the first try with 75 questions. But the NP boards are a little bit different. I did take the ANP, and I took it the second time after studying and getting all of my anxiousness out, and I knocked it out the park, and so I was really excited about that. I just received a job offer that I accepted, so I will be starting in my role next month as a general surgery nurse practitioner in pediatrics. And that's why I always tell people it's important to network, because I'll be at my current facility and I network with the surgeons that I work with every day in the pre-op and PACU areas, and I was able to secure a job where I was their first pick. So I'm still in my current role as a preoperative and post-anesthesia care nurse, because I'll be transferring out next month. And so I know a lot of people were asking like, oh, how do you get in pre-op? How do you get in PACU? A lot of people say, this is funny, like this is where nurses go to like, you know, finish out their career, because the job it's a really good schedule. Like we don't work weekends. I only work like 2 weekends every 8 weeks or whatever. And then I'm like on call for holidays and stuff like that, but that's pretty much it. But they do require you to have like critical care experience, because even being a pre-op nurse, mainly I do float to the post-anesthesia care unit. We're all one unit, but I do float over there when they are short-staffed. So they require you to have critical care experience, because you are dealing with trach patients, people who are coming out of anesthesia, different things like that, airways, all of that. So critical care experience would be like ICU, or if you came from the ER, or you did like cardiac ICU, something like that, are the things that they're looking for once you get into that role. But it's a great role. It was great for me. I love the schedule because I was able to work full time and be in school. So that really worked out for me. So right now, I'm currently working on a lot of things. If you follow me on Instagram, if you haven't done so already, I will link my profile. But I am really, really passionate about guiding nurse practitioner students through their coursework, or getting people ready who are considering to make the change from RN to MSN, and guiding them. And I am creating a checklist that I will be releasing very, very soon, just on how to get started looking for schools and what things you should consider before starting an MSN program, or things that may help you if you just started that journey. But now that I've been talking to you guys, I really think that I probably should make a nurse checklist too, so that'll come later. But my nurse practitioner students, I'm really, really passionate about guiding them, because I had such a like up and down journey through this time, like losing clinical placement because of the pandemic, and having to find my own preceptorships and all of that. That's just a job in itself. And on top of having to study and be in school and have to remember things and take tests, it was just a whole bunch. So I'm really, really passionate about helping them through their coursework and everything like that. So I'll be launching my website very, very soon. It is not live yet, but it will be. The checklist will be a freebie, so that'll be available very soon, probably in the next 2 weeks. It'll be available for download on my profile as well. And, you know, later down the line, I'll be developing some digital courses and opening up my calendar for, you know, NP student mentorship, even if you're a nurse and you're thinking about making a change, mentorship for that, and just, you know, consultation, all of that stuff. So I'm really, really excited about the things that I have coming up for you guys. I hope you guys enjoyed this IG takeover. I'm going to drop the question box and leave it open. So if you guys have questions, I can continue answering them for you.